Hello, I'm Dr. Burton, and I practice in Santa Monica, California. Over the last 33 years, I've had the privilege of helping thousands of people become pain-free using therapies from around the world. These therapies are all FDA-approved, non-surgical, drug-free, and involve little or no side effects. A patient's pain profile is as unique as their fingerprint. Most pain is complex and has more than one cause. There are factors that cause relapses and influence good and bad days. Most healthcare professionals either misunderstand or ignore these factors. It's unrealistic to expect that any specialist's primary treatment concept is going to successfully address every condition. The following are the most common causes of neck, back, arm, and leg pain: inflammation, spinal disc conditions, joint instability, joint restriction, scar tissue, short leg syndrome, adhesions, and joint misalignment. To treat inflammation, I use a therapeutic laser. I researched laser for 2 years using 9 lasers from 5 different countries before selecting an Italian instrument. It is effective in treating inflammation, pain, and even assists in tissue regeneration. Disc conditions of the neck and back are treated with spinal decompression therapy. Decompression therapy is one of the few successful treatments that are non-surgical for disc herniations, protrusions, and degenerative conditions. One of the most interesting things about disc problems is that disc injuries are almost always directional and require specific body positions to treat them. One of the unique features about the decompression table that we use is that the patient can be positioned face down, face up, and with several different iterations of that. Pain generated by instability of the joints in the neck, the back, the shoulder, and the hip are treated with the active therapeutic motion instrument from Australia. This device can help to stabilize the neck and spine very frequently at the first visit. Pain can also be created by joint restriction. The most common causes of joint restriction are scar tissue and adhesion. Scar tissue and adhesion is treated with the Zimmer Impulse radial pulse therapy instrument. This instrument is enormously successful in treating conditions that reoccur in the same place. For instance, low back pain that always comes on the right-hand side. It's also used to treat plantar fasciitis of the foot and calcific tendonitis of the shoulder. Short leg syndrome is a condition that destabilizes the neck, back, and lower extremities. Functional short leg syndrome is caused by a failure of integration between the nervous system, muscular system, and skeletal system. Chiropractors, medical doctors, and physiotherapists recognize it as a significant cause of pain. This is treated using a procedure called the Blair technique, and we have a camera set up so patients can see their legs in real time go from uneven to even during the course of a treatment. Joint misalignment is treated with arthrostim therapy and traditional manual correction.